Okay, so we have patient F, Eastern Indian Hindu. We have Amiyah Nadai, 22-year-old Indian woman. She is 41 weeks pregnant, and in labor and delivery unit. She's married to a Sean, and they recently immigrated to the U.S. from India. Her sister Marilla is with her at the bedside and is encouraging her to get an epidural. Even though she would like one, she reports that Sean would not allow it. When getting Amiyah's blood pressure, the nurse notices that Amiyah jumps when touched and does not look at her when she's asking questions. The nurse is wondering if the patient is in more pain than she's reporting. Sean is waiting in the hallway, but when he sees that a male lab technician starts to enter the room, he intervenes and tells him that he cannot go into his wife's room. And now we're going to talk about the questions.
Okay, so for question 1, what should the nurse understand about the Hindu culture when caring for Amiyah, and how would we implement those concepts and why? We said that the nurse should understand the differences between Eastern and Western cultures. Hindu cultures view pain differently. They prefer to accept it as part of life and karma. They might prefer to have same-sex staff taking care of Amiyah. The nurse should respect Amiyah and her husband's wishes for more non-pharmacological interventions. We also said that birth is considered a sacred event, and it is important for the nurse to know this to be able to provide the proper services that are needed. And then for question 2, regarding the epidural and how can we manage the patient's autonomy without disregarding the importance of family? As a nurse, you allow for the patient to communicate with her family on what they would like to do. The Hindu culture revolves around family, and often the husband serves as a key role when deciding medical treatment like pain management. While as a nurse, you should accept the patient's wishes to involve family, it is also important that you assess whether it is truly the patient's wish for whatever treatment decision is decided. So that could be with a private conversation with just the patient if it's needed. If needed, the nurse should communicate with a culture mediator if the patient is uncomfortable with the decision that the family has made for her. For question number 3, what accommodations could be made to get her blood drawn and why? We said a simple accommodation of ensuring that the person that draws the blood is female would be more accepted by the patient and the family. This is because modesty is important in the Hindu culture, and having a female draw labs would promote practice of their culture. Again, it is important to assess what the patient feels comfortable with, and always make sure to ask the patient if it is okay to touch the patient for the lab draws prior.
So for question number 4, besides the normal labor assessment, what other assessment would you want to do? Include the nurse would specifically do or ask, and why. So we said we would do the pain assessment. This is where we can use the numerical pain scale, since the cultural norm may lead to her underreporting the pain. We would also assess the cultural or religious need and ask if she would like prayer, mantras, or other rituals during labor. And then we would also assess the support system to ask if she's comfortable to have her sister present versus having a husband. So, as this would affect her coping, and then would assess the psychosocial assessment, ask privately about her emotional state, fears, and whether she feels safe expressing her needs. This assessment will improve the nurse with the proper information to meet the needs of the patient. Question number 5, How can the nurse be emotionally present? Be specific and provide rationale. The nurse would do active listening, make time to sit at eye level and validate her feelings. And she can say, maybe, I hear you, it's okay to feel this way. And I use gentle communication, like speaking calmly, slowly, avoiding rushed or dismissive tone. Then patient advocacy. The nurse can be her voice if she struggles to express her needs due to cultural or family dynamics. Encouragement. The nurse would reassure her that her feelings and her choice matters. All these techniques will encourage the patient share her true feelings.
Number 6, how might this be different if Marla was not with her? If Marla was not with her, we believe that there would not be anyone there to advocate for her to get the epidural, because although she wants it, she states her husband would not allow it. So I think that if she wasn't there trying to encourage her to get it, she would not be considering it due to her knowing that her husband doesn't want her to get it. Also, the husband is not allowed to be in the room because during birth it's considered to be a private event. So in their culture, they're not allowed to be in the room. So if Marla wasn't there, Amiyah would end up being by herself, which could come with a whole bunch of other considerations, like a birth alone could be detrimental to her mental state, or just she wouldn't know what to do. And that's it.